One couldn't help noticing that on the graphs that you showed, they were going down until 2010, and then they suddenly started to go up, and I'm not sure quite what happened in 2010 that made that work. But anyway, this 19%, John, you said you were clear that there was a differential between the areas where there was engagement and where there was not, but you don't trust the 19. Just quickly, why don't you trust the 19, and what do you think it's nearer?
We think across Great Britain, so not quite comparing like with like, but we think across Great Britain there are 12,300 people sleep rough every night. So a figure based on counts and estimates of 4,677 for England just can't be credible. The 12,300 is based on all available data, including the government counts, household surveys and everything else, triangulated by Heriot-Watt University. So we think that's the closest we've got to an accurate count.
So in other words, the reduction is less than the government is claiming.
Well, I mean, it's very...
where I'm going with this is what would you want them, what do you want to say to them to make it the reduction greater?
So two questions. I mean, first of all, the data. I mean, I think the thing that is clear in the data is the trend. You know, that upward trend since 2008, 2010 is absolutely clear. The fact that you put more outreach workers on the streets in targeted areas is absolutely the right thing to do tactically, and so absolutely is going to see a reduction. But in the words I said just now, I talked about, you know, if your bath's overflowing, you turn the tap off rather than reaching for the mop, and everything that needs to be done about ending homelessness needs to be about prevention. You know, so many of these things are policy choices. You know, we bemoan the fact that there's been an increase in non-Brits sleeping on the street. But if you make a decision not to pay people housing benefit, then where else are they going to sleep? You know, these things are policy choices. So the opportunity today, the opportunity today in the spring statement from the Chancellor is to return the link between housing benefits and market rents that's now been broken since 2011. So in 2011, local housing allowance was set at the 50th percentile of the local market. The following year, it went down to 30%. Then we went into a period of very small increases, and 3 years ago, we froze levels altogether. And if we rely on the market to provide housing, then we have to link housing benefit to what the market is saying. These things are just arithmetic, they're not politics.
Okay, so, I mean, Al mentioned all this whole area around malnutrition and so on and so forth, and you've talked about, Bill, the desire of the government to get more into prevention. So what do you think the government's response can be to what Al's uncovered? And secondly, isn't one obvious thing to do, as somebody mentioned, is to include GPs into the Homelessness Referral Act?
That was quite, it was pretty stark data that kind of showed. I think our answer is kind of what we have in the strategy in terms of getting those people off the streets and into secure accommodation and providing them with the support that they need. That is, I think, that has to be the answer, and that is what we are committed to doing.
Sorry to interrupt, but isn't the second bit absolutely fundamental to the approach of this faculty, is that actually, you know, housing is merely, I say merely, I've got a house, but is merely the basis from which you can start to provide serious support. So in terms of what you were presenting, is the government actually committed to doing more to provide serious support? You talked about 77% of people having either mental health or drugs or alcohol-based problems. I mean, what is the government doing in that respect? And again, back to the GP question.
Yeah. So in terms of the most severe, so in the Housing First approach that we are piloting, that is providing significant additional support to those clients in those areas. And so that is something that we will, that we think will be successful. And, you know, I certainly hope that we'll be in a position to kind of expand and start rolling that out in a few years' time. We have the kind of commitment from NHS England in terms of additional funding for particularly mental health support for rough sleepers. So that, again, is a kind of a positive start. And then the kind of broader government commitment on the kind of NHS long-term plan and the kind of significant additional funding on that. In terms of the Homelessness Reduction Act, we'll certainly we are reviewing that, and we certainly kind of take that away about whether other agencies need to be involved and whether, it does seem to be kind of an obvious kind of missed opportunity. So we'll certainly, be considering that as part of our review.
Al, one of the things that you said that struck me was when you were talking about the kind of food that most homeless people kind of have access to. You talked about, empty carbs, but you included in that description the kind of food that was being provided by shelters, voluntary organisations, and so on and so forth. So I was struck by that. So is there a real case for organisations that are represented here and others in the homeless sector actually really seriously to review their kind of nutrition strategy and their menus?
Absolutely, and that's really what the session tomorrow is all about, really practical stuff in terms of what we can do.
Okay. Questions, questions, solutions, comments, what would people like? There will be, thanks very much, there's a microphone coming behind. Lady on this table first, and then guy with the beard second. It could have been lady with the beard and then guy on the table, but as it turns out, we're not in a circus.
Just to comment on the nutrition thing, I'm speaking from experience myself, and very much so in the day centres, they're reliant on what they're donated in terms of how they set their menu, and nobody seems to be donating fruit.
Right.
Yeah, I would say I spent 2 months without ever seeing an apple, let alone anything exotic like a banana or an orange. And I don't think that's unusual. And the Pret sandwiches, well, God bless Pret, they keep us going. But dear God, I tell you what, when I got a hostel place, I spent 4 months before I ate bread again because I didn't want to see it.
Thank you. I mean, to what extent, actually, that's an interesting point about donations. I mean, Al, to what extent, I don't know whether this is yours or Crisis's kind of territory, but is it possible to negotiate differently with the supermarkets about what it is they're giving you and what's sell-by date? I mean, is that a conversation that's happening?
Well, it should be possible because we throw away most of the food we buy in this country. I mean, the reality is it's the wrong foods. The reality is the foods that we're providing are potentially causing harm, and the reality is we have utterly failed to recognise and integrate nutrition.
My question is do supermarkets know that? Do they think they're doing the right thing and actually they're not doing the right thing, or what?
I'm sure it's not malicious.
Right. I was just thinking where the match. I don't know the territory well enough, but you know what the question I'm asking is whether that dialogue is possible.
I think it's certainly possible, and if you look at the supermarkets, the kind of relationships they've now got with charities like Fanshawe are absolutely the opportunity for this.
Yeah.
There's a massive arrangement between Tesco and Fanshawe at the moment.
Oh, thank you. If you want to say where you're from and stuff, that would be terrific. Yep.
Yeah. Hi. Phil Timms. I'm a psychiatrist from South London. We've heard GPs aren't included in the Homeless Reduction Act. Neither, bizarrely, are community services or outpatient departments. It beggars belief. And I say this with some feeling because we've seen people freeze to death on the streets of South London because such services have no duty. We know that mental health services are persistently underfunded. There's no sign of them getting better funding, but having a duty put on them might actually help to focus their attention rather than sometimes just giving up because somebody doesn't come to their appointments.
Okay, thanks. Well, there's clearly a large point, isn't there, at the back there? There's clearly a general point for you to take back, Bill, about who's included in that referral process. And by the way, one of the things that did interest me was you talked about the administrative burden in one of your... It seems to me to reduce the administrative burden, and if you're talking about quick response, I mean, it's interesting whether there's a differentiation between the administrative burden that local authorities are experiencing and whether voluntary organisations could do it quicker.
Yeah. I think that's more some of the feedback we've had about when you introduce massive new processes and whether you can do it more efficiently, and getting kind of buy-in from those housing teams so that they kind of recognise the benefits of this and they don't see it just as a burden.
Do try and brief some of the Labour Party people not to nationalise homelessness services either. That's what they're threatening in Brighton. Hello at the back.
Hi, I'm Angela Burnett. I'm lead doctor at Freedom from Torture in London. And this is a question for Bill. You mentioned about some data sharing, I think, from NHS Digital. Okay. And I just wanted to check the exact details of that, who exactly it's being shared with, and whether it's anonymised, because you may be aware that there was recently problems identified because NHS Digital was sharing the data of migrant people with the Home Office. And I just wanted to check that there wasn't any risks of this.
Yeah,
Thank you very much.
So I think I was talking about NHS data on a kind of more macro level. There's definitely no individual case level data being shared with my department in that regard.
Down here, and then there's somebody at the back there, and I don't know whether and there's a lady in the middle there with a red sweater. If you could, it may not be a sweater, of course. I apologise for that.
Yeah, Stan from Pathway. Bill, one of the things that, for me, doesn't speak as loudly as it should is the safety bit regarding council stock and council houses, because nothing should read better than safe, secure, affordable than a council home. And yet, under this government and probably successive governments, you've allowed the sale of council stock at hugely inflated cost to the country because we subsidise that. And then you've allowed them to be rented back and for housing benefits to pay for that. And thanks for giving me a little thing I can twist. I think basically what you've got is the bath with the plug out. Nothing's going to fill it. So if you're going to put more stock in, surely you should stop it leaking out, period. You need to keep and secure the stock you've got. And also, you should legislate against formal council stock being used to take money out of the system, the housing benefit system. If you're reducing property by 70% to start, then why are we continuing to pay for it at the detriment to this?
Yes. Clearly, there's a big problem there. It may not be a question that's in the bailiwick of a civil servant to answer on the basis that it's a policy and political question, but have a little stab. When you say that to Mr. Brokenshire, a curious name, of course, because it is broken, but what does he say?
I don't think I've had a particular policy discussion with him about right to buy and the impact
Give
that
it a go, love.
I probably shouldn't comment. I actually did see there was some recent household data, ONS data that I think was published this week that showed the number of vacant properties in the country. And I was also just clicking on kind of each year the number of council homes available, and it had been declining by about 10,000 a year for each of the last kind of 7 years that I kind of just clicked on the data. I think what the Secretary of State would say is that some of the things that I said in the slides is, it's got quite new things. This government kind of committing to building kind of homes at social rent and like raising the HRA borrowing cap. They are quite big changes in government policy, and we'll see where we get to in the spending review for the next kind of 4 or 5 years in terms of building more council homes.
Okay. But to be fair, good points. But to be fair, I'm not sure we can get Bill. We need to have a minister here and hold them to the fire. But thanks very much. There's one at the back in the corner there.
Maggie Kirk, GP in Bournemouth. In our area, we've benefited from the MHCLG funding, which has been fantastic, and lots of money has gone into mental health. Well, primarily the housing initiatives and the street outreach. So you've talked about mental health also receiving funding, and we've had to, in our area, set up a mobile primary care GP service to provide accessible healthcare for the rough sleepers who are not accessing traditional healthcare. Can you tell us what can be done more to influence the clinical commissioning groups to fund more GP primary healthcare for rough sleepers, please?
To some extent, that might be a question better asked to Steve tomorrow. Can we keep that question? Because we will have, the NHS here tomorrow to kind of nail them down. Are you all right if I part the question, unless anybody's got particularly something they want to say? Important question. Can you ask it again tomorrow? Thank you. Sorry to do that to you, but I think we'll get a better answer. Lady in red. Always
Hello.
Nice to be able to say that, isn't it?
Oh, I love that song. Hello, I'm Caroline Schulman. I'm a GP in Homelessness and Inclusion Health, and I work at the King's Health Partners Pathway team and also lead on some work on palliative care and homelessness from UCL. I really have it's a combination of a question and a comment. One thing that we find certainly as doctors working within hospital is that there is a huge gap in provision for people who have multiple and complex needs, so have a combination of really profound physical health problems in association often with addiction issues and mental health issues. And there is actually nowhere currently for people who are very sick to go. A hostel may not be adequate to provide the care that they need, and there are no alternatives. Now, I know that Ed Davies' second reading of his end-of-life care bill is potentially due for reading on the 22nd of March, which I've just found out. And that's really exciting because that's, and I don't know if anyone has comments on this, because that potentially says there has to be a duty to, for housing, home and CCGs and social services to work together to ensure that people who are potentially in the last year of their lives have appropriate supported accommodation, which is correct and appropriate for them. And it includes people who are intentionally homeless, and it includes people who are non-UK nationals. So I really wanted to put a shout here to Sir Ed Davey for proposing this bill, but I also wondered if the rough sleeper strategy is really considering what to do with these people with really very profound and multiple complex needs.
John?
Firstly, I absolutely agree with your comments on what Ed Davey is trying to do. And just appalling that he has to do that, and that isn't something which happens anyway. What I would say is, not necessarily for that group, but for the group of people with more complex needs, it's the most evidenced area of homelessness, and so often homelessness services are not based on the evidence we need, but the most evidenced area is the work of Housing First, where it's done properly. And I think the sooner we can move on from this idea of piloting, the better. So we think out of the 170,000 individuals and families who are experiencing the worst forms of homelessness at any one time in Britain, 18,000 of those would benefit from and would need a Housing First solution. 18,000 out of the 170,000. At the moment, 350 people in this country are getting a Housing First solution. And even when the 3 pilots are up and running at full scale, that'll be 1,350. The evidence is absolutely there. The economic arguments are absolutely there.
So get on and do it.
And actually, to mention James Brokenshire, he is clearly coming to the conclusion that Housing First is credible. He was talking last week about a potential trip to Finland. So, anything we can do to encourage him to move to scale would be beneficial.
You've got a second house there, is that why is it going to Finland is where they've piloted this successfully, is that your point? It's always bloody Scandinavia, isn't it?
Just following on from what Caroline said, yes, there's a gap in the system. Yes, we need a sensible level between hospital and the street. That is an intermediate care service, and that should have been part of the furniture of healthcare in this country for the last 2 decades. We were in Rotterdam a few months ago for the International Street Medicine Conference, and I'd just like to highlight the fact that it's a different conversation over there. And the notion of a rough sleeper strategy would be anathema. We had one in 1998, and the reason why we're having another one is because that didn't work. The debate in the Netherlands and many civilized European countries is about ending homelessness. That has to be the start of the debate, because as the data quite clearly says, it's a dose-related response, and any significant exposure to the extreme end of homelessness, the politically unpalatable end of homelessness, the visible end of homelessness, rough sleeping, has catastrophic health outcomes. And to focus the debate entirely around rough sleeping still is a complete brain failure. Just to pick up on the 2 million allocated to test models of services, again, I'd just like to reiterate, and I think it's about time somebody quoted Aidan, no one's ever done a randomized controlled trial of the parachute. I mean, the bottom line is there's plenty of evidence in terms of what works. We've done our own review recently and published it in The Lancet. There is a stack of evidence in terms of what works. And we know what works. We know what to do. And we also know what to do upstream as well, because back to this notion of not ending rough sleeping, but ending homelessness. It starts very early on, and it starts with poverty. The reality is 2 billion quid, yep, very nice, to pilot a few interventions nationally would be a new box of paper clips for everybody. We need some proper and serious investment in terms of the homelessness agenda, in terms of ending homelessness, and we need to stop thinking that we can put a sticking plaster on rough sleepers.
Thank you very much indeed. Thank you to Al and to Jon and to Bill.